So, welcome, dear colleagues, to Endo Dubai 2021 and to this STORZ symposium. The task of this lecture will be to give you some, let's say, practical information regarding the shaver technique, and I will leave all the clinical information to my colleague Sherazad Ansari. So the title of my presentation is to understand the IBS setup and application in an ambulatory setting. So as we are talking about office hysteroscopy, I think it's wiser to speak mainly about the 19 French shaver, which was introduced in 2018. Still today, the 24 French shaver is used everywhere, especially here in China, where the 19 French is not approved. But of course, then as we go from the big size to a small size, the 19 French shaver should be preferred, especially if we are talking about an ambulatory setting. So you see we go from 8 millimeter, which is the 24 French conventional shaver, which is the optic is the difference, to the 19 French shaver, which is 6.3 millimeter. The setup it's really well described in this video made in China. The shaver actually, both the 19 and the 24 French shaver is made by the optical part. The only difference, and this is the 24 French shaver, that the 24 French optic has a double flow system, and which differentiate from the 19 French, which is only a single flow system. And these are the units. For the shaver you need to have a special pump which is connected to a special unit, a special engine, and on the other side you have the optics, which is connected to the conventional AMU system. As you see, when you enter the cavity, you open the inflow on the optics, and you can also open the outflow in order to clean your view. This is, of course, is the 24 French shaver. Then you insert into the operative channel of the optics the shaver itself. The shaver hasn't changed between the 19 French shaver and the 24 French shaver. On the shaver you have an suction, so you have an inflow on the optics and an aspiration on the shaver. This is the SP blade, which is a fluid beak shape. As you see, you don't go out anymore with your instrument. You see the pathology, you go closer to pathology, activate the shaver and remove it. You can insert into the operative channel also forceps, scissors and bipolar probe, like it is shown in this case, which are the 4 millimeter instruments, which are very strong and very precise to compared to the 4 French instrument. The pedal of the shaver has two switches. The first switch activates just the suction, while the second switch of the pedal activates the engine in order to remove the pathological tissue. You see, these are the system. This is the conventional AMU, which you can connect just to the optic, and you should connect the inflow and the outflow to the AMU. This is the engine, which is connected to a special pump. This engine is an unit drive which can reach the speed of 5,000 rotations per minute, and this is the Endomat LC, which is the pump connected to the engine, which can give a maximal aspiration of 1,000 milliliter per minute. So this Endomat LC is very good, especially if you need to increase the suction. As you can see on this animation, you insert the shaver first, you do the dilatation of the cavity, you remove the polyp, and then you can also insert the bipolar probe in order to stop the bleeding. So as every endoscopic equipment, you can divide the system into a software, which are actually the instrument that you are using, and into the hardware, which are the units connected to the instrument. So as you see, that as a software, you need to have an optics, which can be the 19 French or the 24 French size optics. You need to have a shaver blade, and which is connected to a drill cat handle, so you should connect the blade to the handle. You need a light cable, you need a tubing set, which is Actually, very interesting, because on the Endomat LC the tubing are reusable. So as all the system is reusable, also the tubing set connected to the shaver itself are reusable. And then you need a normal cell line as distension media. So in this picture you see the difference between the 24 and the 19 French shaver. Mainly, you should remember that the 24 is a double flow optics, while the 19 French is a single flow optic. So the suction is actually always placed on the shaver. As you see, the real, and this is the most important part of this instrument, the shaver is as a double window blade. There are two type of shape. One is a flute beak shape. The other one is resemble the jaws of a shark, and the size of the window is 25 millimeters square. But what is really important is that the inner blade, it is a double window blade, which is differentiate the shaver from all other instruments. So it's not correct to speak, when you speak about the shaver as of morcellation. The shaver acts actually like a real shaver, and the double window blade makes this instrument very excellent and very aggressive too. So this is the secret of the shaver compared to any other devices. So remember, when you speak about the shaver, it's correct to speak about a shaving system, not a morcellator system. The setup, it's the same setup you use for operative hysteroscopy regarding the optical party. So you need a monitor, a camera, and a light source. You need the AMU endomat, which is connected only to the optics. So remember, you can separate the optical part to the shaver part, also regarding the units, in order to not to make confusion. So the AMU is connected only to the optic, and you need to have an inflow and an outflow, which are actually connected to the AMU. On the other side, like you do with the resectoscope, for instance, on the other side you need to have two units which are only connected to the shaver blades. So you need a pump, and you need also an engine. So the engine will move the blade, and the pump will aspirate the tissue inside the blade. So this is very important. So for instance, you need for the shaver a Unidrive S3, which has a maximum power of 5,000 rotation power per minute. You need to have then a pump which is connected to the engine, and we in China we still use the Endomat LC, which is a maximal suction of 1000 milliliter per minute. It's the most for the moment, it's the instrument who has the maximal suction compared to any other devices. In alternative to this pump, it has been proposed by the company to use the Endomat Select, which is another pump, excellent pump, which has the only disadvantage that the suction is less compared to the Endomat LC. And then, of course, you need the AMU endomat, which is connected only to the optics, which you use the same parameters that you use normally for operative hysteroscopy. So these are the two units connected only to the shaver. You see there is a cable on the back which synchronizes the two units. And as I told you, the pedal activates with the first switch only the suction, so you start sucking the pathological tissue inside the blade. With the second switch you activate the engine. So it's very important that this unit, so the Endomat LC, which is the pump of the shaver, and the Unidrive S3 are connected on the back with the cable. So always check that this is working. You can separate these two units from the AMU. You keep these two units on the right side of the patient, and you keep the AMU on the left side of the patient, so you cannot make any mistake when you do the septing. So the best parameters for the shaver are these two. For on the Endomat LC, you should use a maximal suction on 250 milliliter per minute. With this suction, you will never have the collapse of the uterine cavity. According to the size of the uterus, sometimes you need to reduce this suction to 2000, especially in China, where the uterus size is much smaller compared to the Western uterus. Regarding the speed, we suggest that this is the average speed you should always use, 2100 rotation power per minute, as it gives already a good grip to the tissue. Remember that when you are dealing with myoma, we suggest another setup, which is to reduce the speed. 2100 for myoma for hard tissue is too fast. You will not give the time to the tissue to go inside the blade, so you have to reduce the speed to at least 1500 rotation power per minute. Don't go lower to this speed, because then you will have no effect. And on the other side, you should be able to increase the suction. That's what I think that the endomat LC, especially in trained surgeon, is very good when you deal on myomas. You should increase the suction. Always be careful when you increase the suction, because you can make, of course, a perforation if you are not careful. But just go inside the tissue, keep the window in contact to the tissue, and you will get the advantage. So this is the recommended setup with the endomat LC. As you see, the number one is the setup only for the optics. So you need an inflow going to the optic, and you need an outflow which goes to a special container and go back to the AMU. This is only for the optical part. So you need one pump just for the optics. And if you are talking of the new optical system, the 19 French shaver, you need a pump only for the optic, which could be the endomat select or still the AMU endomat. The second, let's say, circuit is just dedicated to the shaver. So you need to connect the shaver, the back of the shaver, to a pump in order to have a suction, and you need to connect the back of the shaver to the engine in order to have a oscillating movement. So these two units should be separated from the AMU and from the endomat select if you have the 19 French shaver. It's more difficult to explain this setup than to do it. Once the nurse do this setup 2-3 times, they prefer to do this than using the receptoscope. So which are some practical tips? You should these are the only things you have to know regarding the optical part of the system. You have to learn how to rotate the optic. You always have to remember that the window is the cutting power of the shaver, so the window has to be always in close contact with the tissue. And you always have to remember that you can insert into the operative channel of the shaver also scissors and bipolar probe. These are nice animations show you that when you do the rotation, you always have to keep the camera in the same position. Don't rotate the camera, otherwise you go upside down. But this is a general rule of hysteroscopy. So this also slides show that when you start the procedure, if you are in this position, so if the camera is upside from your side, is on the upper part, first of all, you remember you always have to hold the camera with the left hand and try to hold the shaver with the right hand. So the shaver is always positioned opposite to your camera. So if your camera is anterior, the shaver will be posterior and will go out to the posterior wall of the uterus, like in this position. So if you want to go from this position to the anterior wall, you have to do a rotation of 180 degrees. For instance, like this, you see the camera is going to the lower part, and the shaver is going to the upper part, and it will be touching the anterior wall. And if you want to go to the left side wall, you just do 1/2 turn to the left side, and always you see the camera is always the opposite to the position where the shaver is coming out. If you want to go to the right side of the uterus, then you have to go completely 180 degree rotation on the other side. And in this case, of course, you should be able to cross your hand or to change your hands in order to have the shaver going close to the right side of the uterine wall. But this movement actually comes very natural after 2-3 times you use the shaver. This video shows the possibility that you have by using the shaver. Don't think that you can only use the shaver blade, but you remember you can use the scissor, you can use the bipolar probe. And this video is very nice because it is a two-step procedure, because we had the blade of the instrument broke down. As you see, there are a lot of bits floating around. When you have this situation, it means that the suction is not good, that you have a problem on the blade, or you have a problem with the pump. So you should always remember that when you have all these bits floating around, there is something which is going wrong with the system. In this case, it was a problem of the blade. So when we changed the blade, we were able to improve the heating of our system. But of course, the fluid deficit had increased too much. So we decided to stop this procedure and to do a second step procedure. See, in this case, we have changed the blade. There is no bits of tissue floating around, and the heating also of the tissue has become more aggressive. Unfortunately, when we did this video, we still didn't change the speed of the shaver. If we now could reduce the speed of the shaver, I'm sure that we would be even more successful in a single step procedure. This video shows also that you can approach septum or synechia with the shaver, and if the consistency of the synechia is mild, you can really remove the septum or the synechia with the shaver. But at this point, we decided to start the procedure and to go with a second step procedure. And of course, with the second step procedure, we were able to remove completely the myoma, as of course the blade were working fine. And also we have been able to remove in this case is a synechia, and this was an infertile patient. So we think that even if we did a two-step procedure, we did a good job for the patient, because of course we were less traumatic, as you are always less traumatic when you use the shaver. We removed the myoma without using any form of electricity, without any resection. For instance, we work very close to the tubal ostia, which is also something very dangerous when you use the resection for the fertility of the patient. And we did use the scissor, and by using the scissor we increased the size of the cavity. So for this patient, the possibility to become pregnant and also to not to have a miscarriage has increased as a lot. I mean, we think that by doing this procedure, we increase the possibility for the patients to conceive. As you see, the size of the scissor is much bigger than the front for French scissor. You are much faster. Of course, you have to be careful, because the size of these scissors is actually like the scissor that you use during mini laparoscopy. So you are very effective. You are very let's say effective. This is the right word, but of course you always have to be careful in order not to make any perforation. Okay, so remember, you can always use the scissor to combine your technique. These other videos show the possibility that you have also to use the bipolar probe. When I started to use the shaver, I didn't have the possibility to have any kind of coagulation. And to tell you the truth, we only faced one bleeding problem. But when the bipolar probe was already existing, and it was actually for a myoma very close to the cervical canal, and we didn't use the bipolar probe immediately, so probably we go through big vessels close to the cervix, and that's the only bleeding problem I had on more than 2,000 cases done with the shaver. Now, with the availability of the bipolar probe, if we see that there is a bleeding problem, we use it and we stop the bleeding. Of course, we always try to use oxytocin at the same time as we do the procedure. In cases of placenta remnants, for instance, we try to do selective coagulation in case we suspect some bleeding. So we remove this small myoma with the blade. We didn't actually finish the removal with the shaver blade, but we aspirate the myoma. What I want to show you is the beauty of this bipolar probe, because you actually see the difference between the healthy endometrium and the fovea of the myoma. I think this image is really nice. It's much nicer than the myomectomy itself. You see how clear is the separation between the healthy endometrium and the place where the myoma was. And this you can achieve only with the shaver. There is no resection. Even the small receptoscope cannot give this kind of precision when you are dealing with myomas. So you can have all this information by going through the CELIC range guidelines. We wrote some guidelines together with Rudy Campo regarding our center of Shanghai. There is an English version and a Chinese version, so I hope that STORZ will provide in short time also some guidelines of our center in Europe, so you can go through all this technical information. So I always like to say thanks to my friend Rudy Campo, and especially to my friend Ivan Bele, who's unfortunately not with us anymore, and to all members of the Rollerball Team Austria. So thanks again for your attention, and thanks again to my friend Arnaud for this kind invitation and for this great opportunity to speak about the share during Endo Dubai 2021. Thanks again for your attention.